My name is Kristen, and if there's one thing you know about me, it's that I love to travel. My boyfriend, who's my now husband, is my travel companion, and we've gone everywhere. Even though I was traveling around the world, I had no idea I was at risk for TB. My husband and I are fairly cautious travelers. We always check the State Department, we check the CDC recommendations for which vaccines we should be getting. I have every vaccine you need for all of the countries I visited, and never was there any mention about being at risk for TB. The more fun stuff that we would do, like take 24-hour train rides through India and take boat rides through Indonesia, bus rides through Southeast Asia, long plane rides to South Africa. One of those things got me sick. And I had no idea because throughout all of that travel, I never felt sick. And I came home, and over time, about the course of 8 months, I started to develop a little bit of a cough. And that cough eventually turned into coughing up a little bit of blood. And that's when people started to pay attention. So they did a panel and looked for TB, and sure enough, I had TB. Immediately, the doctor called me back. I've never had a response from a doctor so quickly ever in my life, and suddenly everybody sort of descended upon me and quickly made me aware that I was walking around with something fairly contagious. I had no idea where I had contracted it, but I knew I was fairly sick. And it included about 8 weeks of being quarantined by myself at home. I couldn't have any contact with people in supermarkets, at work. I had to tell my friends and family that I had contracted TB, and that in the course of the 8 months that I had the illness and I was around them, I might have infected them as well. They then had to go and get checked and make sure that they didn't have it either.
Of course, one of the first things that the public health department did was have me go ahead and get tested.
We found out that my husband had LTBI. LTBI, that's the latent TB infection.
I have got a potentially deadly disease that is in my body. It fortunately has not, turned into its more deadly state yet. I don't have a lung infection that's, going to kill me, but that could happen, and it may very well happen at some point, over the rest of my lifetime unless I get treated. Why in the world would I not go through that treatment? And the treatment for LTBI is significantly less impactful on my life and on my body. It's still a lot of antibiotics. Gosh, I stopped myself from potentially developing a much, much, much more serious condition. So I'd be walking around with this infection and have no idea of it. I may have gotten it at the same time she got a latent infection, and mine just never turned into an active infection, an active TB situation, and hers did.
Walking to my doctor's appointment.
One of the more fun ways that I was able to stay sane through the process was documenting my journey on Snapchat and Instagram. And I think that's a little bit unusual because there's a little bit of shame associated with having TB sometimes, but for me, it was an outlet, and it was a way to have a sense of humor about taking 10 pills a day.
Like a champ.
Luckily today I'm healthy and happy, and I cured it, but had I known about this disease, had I known that the places that I was traveling were TB hotspots, I would have come home and taken a test and caught it before it ever turned into anything bad.
The latent TB infection is treatable. Maybe luck of the draw, maybe I got it from her, who knows? I like to say I got it from her, but as I understand it, in many parts of the world, you've got thousands and thousands and thousands of people walking around with LTBI that, it's a little bit of a time bomb. They may or may not get sick at some point, and that may or may not proliferate the disease. In the United States, we, have the luxury of being able to get tested, being able to get treated for LTBI, and sort of stopping the spread of a disease in its tracks. And, in a very small way, I'm really proud to be a part of that and sort of help stop that spread.
I wouldn't have changed my travel plans. I would have adventured the same way that I did, but I would have come home and I would have just checked, did I have exposure? Because I would have known if I had exposure that I could have treated it with a little bit of medication, and my life would have gone on and everything would have been fine. I feel lucky that I'm healthy and traveling again today, but it was quite an ordeal to go through. So for anybody who's recently got a diagnosis, the good news is you're going to start feeling better. And so you should not worry about how you contracted TB. You should just be glad that you found it and that you can be part of preventing others from getting it. And know that in just a short while, you're going to feel okay again too, and that your life is going to resume just like normal.